Okay, hello everybody.
Hi, teacher.
Hiya. Welcome today. Hopefully we get a few more people here. Just got 3 of you at the moment. Let me just check while we're waiting for a couple of other people to come. Have I got all of your? Okay, well, welcome everybody. We're looking at part 4 of health promotion. And today we're going to look at some of the approaches, the actual practical approaches that are taken to plan a health promotion campaign, really. This is fairly important for you to know, because when you do your campaign, you've got to choose one of these approaches, okay? So today, I want you to, as you listen to it, give some thought to, you know, which one of these approaches do you think would work well for the subject that you're going to be doing, okay? Okay, so as I said, we're looking at part 4. Part 4 is approaches of health promotion. On Tuesday, we talked about models. I know they're fairly complex, but you have to have the theoretical background. But now we're actually talking about the approaches, and these are sort of as I said, the practical aspects that help you work out the style of your campaign and the sort of activities that you might do as part of your campaign. Oops. Okay, so health promotion activities is classified into sort of 3 different levels: primary, secondary, and tertiary. Okay, so a primary health promotion campaign will be focused on the entire population. And the idea is to reduce general risk, okay? So it could be to prevent the onset of disease through educating people about a risk. Or it could be, I mean, it might be a sort of a disease that is actually around, but it's to prevent it getting bigger. Okay, so would anyone give me an example of what might be a primary campaign? Just, you know, what sort of risk might we be talking about? Anybody got an idea? So something that affects the entire population, something that might be a new risk, or, you know, and a way, or a new disease that's starting out that we might want to let people know about. COVID, yes, of course. Yeah, so the sort of health promotion that we looked at in COVID time, particularly early on in COVID, was a primary health promotion activity, okay? So it focused on the entire population. It was about a new disease, and the aim was to give people enough education to prevent the onset of disease. Now, I know we didn't all manage to prevent the onset, but I think if the education hadn't happened and people hadn't been told about hands, masks, distance, those sorts of things, it would have been a lot worse. So the idea was, although they weren't able to prevent the disease coming and spreading, they did manage to, you know, the aim was definitely to reduce the detrimental effect, really. So that would be considered a primary campaign. So something like COVID, something like where you are in Malaysia, the work they do with malaria, it's something that affects the whole population, and there are precautions and there's education given to tell people how to manage that too. And again, they can't actually eradicate it completely, but it's about keeping it, you know, keeping it a bit under control, really. A secondary type of health promotion activity is really focusing on people who are already at risk of something, okay? and it's aimed at reducing those risk factors. And that's to sort of, that uses fairly routine processes to prevent diseases from progressing. So, and it would maybe use screening or regular testing, things like that. Can anybody give me an example of something like that?
Smoking.
Already at risk, prevention of this. Depending on whether, if they'd have already had some physical problems from it, like a lung effect, then yes, you would go on to sort of screen them and help, you know, try to sort of reduce it. But anybody think of anything else? Something that we screen for maybe regularly, you know, that people. Maybe something that the ladies might think of. You're all a bit young probably, but what sort of things are there?
What about cancer, disease, or
Yeah.
diabetes?
Yeah, both of those actually. Diabetes, there is regular levels of screening. Obviously, they teach the people to screen themselves on a regular, you know, on a literally a daily basis with diabetes. But also there will be diabetic clinics that people will attend where all aspects of their diabetes will be looked at to, you know, and then they will sort of come with some interventions. So to avoid the disease getting worse, or if there's a problem, if there's some changes, you know, to do something about it. So they would have an ongoing screening process. So these would be people who are already identified as type 1 or type 2 diabetics, or they might be, because of their weight and age and everything, be considered at risk. So they might have maybe an annual blood test just to see, you know, if it's got worse. And also cancer, you quite rightly said, things like breast cancer screening is a classic one, really. So it would be women in a certain age group who are seen regularly every 3 years after a certain age, where the risk of breast cancer is higher. So they would be seen every 3 years, and then they would get mammograms taken, you know, sort of like x-rays of their breast to look for any lumps or anything like that. So again, they're taking people at risk, and the risk they're using really is often people's age, in that case, age and maturity sort of level. And that might be the same. It's the same for other types of cancers as well. You know, women over a certain age will have cervical screening. That's also every 2 or 3 years. And in an area, you know, depending on your genetic makeup, if your risk is higher, they might do it much more frequently. Okay, so they might look at your genetic makeup. If you're carrying the BRCA9 gene, you'll probably be screened like several times a year, really. So that's quite a classic one, really. Okay, so that's secondary. So aims at reducing the risk for people already at risk. Okay. And the third one is known as a tertiary activity, third level. And it's aimed at people who are already suffering from ill health or social disease or disability. And it's about sort of working with them to manage it. Can anybody got an idea of what that could be? So you can think of, even though we looked at diabetes in secondary, that would be for sort of people at risk of getting diabetes. But if someone's been, you know, had diabetes for a long time, they might be really, you know, monitoring them carefully to avoid any of the complications from diabetes at a later date. There are complications when people get older. and it can have all sorts of different effects, which I haven't really got time to go into here. Another thing with people with heart disease, they've already got heart disease. So there would be interventions, health promotion interventions that you can work with people who are already diagnosed with heart disease, or who might have had a mild heart attack, for instance. And the health promotion with them would be how to manage themselves so they can reduce the chance of maybe having another heart attack. Okay, so that's quite specific. They will always have their heart problems, but we don't have to just let it get worse. Health promotion will be telling them what to do to reduce the chance of that heart attack reoccurring, or a stroke, or something like that. So someone with high blood pressure, trying to avoid it becoming a stroke, say, for instance. So the health promotion will be very focused on what we do to avoid it. So you've got 3 different levels here, working with 3 different types of groups. And as you can see, as you go through the levels, the group sort of gets smaller and a bit more focused. And so would your health promotion activities that you chose to use. Okay. Okay, so let's think about the different approaches. And different approaches will really affect how you plan your activities and your campaigns, what sort of things you're going to do. Because once you set your approach, they all need to follow in the style of that approach. Okay. And we look at different approaches sometimes for different groups of people. And you have to decide what's the appropriate approach for your group of people that you're going to work with. Okay, so the choice is yours, but as part of the assignment, when you're doing your planning, you do need to explain and justify why you have chosen the certain approach. Okay, so the empowerment approach is the first one. And the empowerment approach means empowerment means to give people power, or give them the authority to do something. And the idea of this approach, it enables people to talk about, what they're concerned about, and also to get the skills and knowledge to do something about it. So you're empowering them to make their own changes, really. You might not be standing there monitoring them. What you would do is you may well do a one-off group with them, and you may remain available if they can, to contact you for advice or thoughts, or, areas where they can express their worries and that. But generally, they take it and run with it themselves. And this approach sort of really looks at some of the wider factors of health. It doesn't just focus on medical concerns. It sort of looks at how things fit with your lifestyle and that, okay? Because if you're empowering someone to make a choice to do something, they will only sort of make that choice if it works, if they can work it into their lifestyles, or if it suits them, really. So the health promoter, you will act as a catalyst at the beginning. Okay, you will give them the ideas and the support. And as I said, and you might have to give them some skill training on how to do certain things. And then you withdraw fairly quickly. And the empowerment approaches is often considered to be effective use of the health promotion team, because they just sort of jump in and they kickstart people's ability to look after themselves, really. Okay, so for some people that can be really, really effective. So what sort of activities do you think you would consider the empowerment approach? Has anybody got any thoughts about that? Anybody got any ideas? No. So you might go to a sort of sign up for like a lecture on nutrition, really. And you might sort of go and read about it and then find out there might be something that people aren't very good at, like, you know, it might be a general basis of like healthy balanced meals. You might go to a part of the session might be a cooking class to sort of show, you know, how things go together, and some sort of basic meal ideas. And then you might give out some information like, you know, a well-balanced cookbook or something for that. And then people will go away and they'll take it away and they'll, you know, they'll do it in their own time and that. You might find the health promoter might be, you know, might hold a website or an email or something for a bit of advice if people are stuck for a bit. But generally, people will move on from you once they gain their confidence and they're using their cookbook, and then they'll be getting their own cook, you know, they might be getting additional cookbooks that are interesting. But you've given them the basic sort of basic skill and basic idea to go off and sort of eat healthily for the future. And then they will take the initiative to maybe join other classes or do other sorts of things, really, or just, you know, cook well for their families. These ones can be a bit difficult to get feedback on. You have to make sure you get your feedback sort of after the initial class, because some of these people you may never see again. Some of them may sort of come back to you, but what you won't be able to offer is a lot of follow-up service, because the idea is with the empowerment approach, people use it when they want to work with sort of big groups and get around, you know, and get this sort of idea out quickly. But it's not always great for people who need lots more reassurance or, you know, haven't quite picked up the skills. Okay, so that was the empowerment approach. The next approach I want you to have a think about is the educational approach. And this is sort of quite a traditional approach, really, one of the older approaches. And it's really to give people the understanding and skills so they can make informed lifestyle choices. The aim is not really to try and persuade. So within the activities that you do, you're not really trying to sort of get people to agree with you or do what you want. It's really about giving them the information. And then the assumption is that if they've got the information, they've got the personal power to go off and deal with it, as they think. So the outcome of this will be the client's choice, really. They'll go in, they might just read a book, or they might come and take one of your leaflets and go home and think about it. And they might act on it or they might not. And the action they take might not be the one that you want them to do. But the whole point about this approach is it totally respects the individual's right to choose. So the promoter, the health promoter, sees it as their responsibility to approach the health issues that they see as being in the client's best interest. So they're there, you know, with the sort of zeal and enthusiasm to say, we think this is in your best interest, but they do not follow it up. They don't chase it up. They really just let it go. Okay. So obviously the negative side of that is it's very hard to gather statistics. It's very hard to see whether any changes have been made, because really you're just offering education and you're not offering any other form of follow-up. Okay. So in the sense of if as a health promoter, you're given a target to meet, say that all people, I don't know, all people are eating healthily, then it's very hard for you to evidence your target. Just be aware of that when you're choosing it. A lot of people choose the educational approach, especially for this assignment, because it's quite easy. But in the bit at the end where you have to talk about sort of the pros and cons, you can say, well, you know, this was quite easy to do, but I don't really know how much effect it's had. You might be able to send out a questionnaire in a few months' time, but you know, you can't really guarantee that people will respond or anything, because you haven't really invested that anything in that relationship between you as the promoter and them. It's just, you know, so it's a fairly sort of alien thing. They come along, go to an educational session, and then they go away and then decide what to do about it. But it does respect their rights to choose. Okay, the next approach is one that we're a lot more familiar with, or very familiar with, and that's the medical approach. And the medical approach is probably the oldest health promotion approach. If you remember, going back to what I said in previous classes, that's sort of how things developed. And then we started to try and get people more involved rather than just telling them, I'm a doctor and I know best. But the aim of the medical approach is to reduce statistics and to reduce, you know, certain illnesses. You may be given a target to focus on a certain disease in a certain area. Maybe one of the towns where you work or one of the villages where you work has got a high level of a health problem or an illness. So your job is to try to reduce those statistics, stop people dying, stop people getting sicker, you know. So really it's about preventative medical procedures. So this is going to have very much a medical focus, really. It's probably going to be led by doctors and nurses. The health promotion role is very much there, but they might need some of their colleagues to be part of the activity, because it might be about taking preventative tests and things like that. So the cancer screening approach I talked about, where people will come into hospital, have the mammogram, check their breasts, make sure there's nothing there, go away, wait for the results. They don't really do anything. You don't, when you come for your screening, you don't get any talk about, you know, good ways to eat, good ways, you know, other ways to look after your body. It's really about looking at the pictures, you know, is there a lump there, is there not, off you go. Preventative medical procedures, and if they found one there, it would be treatment whatsoever, really. So the responsibility with the people who use this promotional approach is really just to get patients to actually comply, to turn up to their appointments, undergo the tests. And that's sort of it really for them. And again, it sort of just sees medical interventions as really important. So if you are a health promotion worker using the medical approach, you very often would be a doctor or a physio or a nurse very often. Now, the medical approach can be criticised because it often just looks at the illness and doesn't really look at the world around it to see what's making you know, that could be making people sicker. So we're not looking at people's social environment, you know, is there something that means they're not managing their health very well? They would look at the genetic issue if it was, when we're looking at cancer, some cancers are genetic. They certainly would look at that because they would see that as part of the medical approach. But they wouldn't look at the environment. So if people are so poor that they can't feed themselves properly or heat their homes properly, you know, that sort of environmental, or are in, you know, a state where they're living in overcrowded population. And these things can actually have an effect on their general health, which means that even if we're just screening for breast cancer, this could be made worse by the fact that the person's not very healthy, not able to eat well, so therefore not able to fight these cancers when they come along. Because your body does try to fight cancers, but you need, you know, you need to be fairly healthy to even start trying. So they don't really take that into consideration. They very much focus on the illness. So it's a fairly isolated view, and particularly around something like heart disease. Obviously, social environmental factors are really, really important when you're looking at something like heart disease, because you could be in a stressful job that's actually creating your heart disease. And if they're just sort of testing you and just keeping an eye on you, and they don't think about your environmental situation, that your job's so stressful that you know, they're not really helping you manage the heart disease. So that is a weakness of the medical approach. It very much, you know, sticks within its role. Now, you know, nowadays most medics have taken a wider view, and I suppose this one is not being used so much. They sort of, even when they're doing screening, they're starting to try and think of a wider one. So they'll be taking one of the other approaches, really. This is effective because it can meet targets, and you can gather lots and lots of data, because you often see people for screening, you know, they come for appointments, they have their screening, and it's more data, lots of results. So in that sense, it's quite a hard, you know, easy one. Solid information is what I mean. So quite easy if you have to show it to your boss to say what you've been doing, you know. So that's why some people use it. But there is a criticism, as I said, that it just doesn't look at the world wide enough. It looks at the illness in isolation sometimes even from the person and their emotions and that. So think about that. Is that an approach you'd like to take? As I said, the sort of activity is often things like tests and screening. So it's not something that you would be able, because you don't have the access to those facilities. So for a campaign for this assignment, it would be a difficult one for you to do because you can't do the tests. Okay. However, somebody did do it before, or they used an aspect of it, because they used the, you know, COVID lateral flow test as a. So you can think about that. Okay, another approach is the behavior change approach, and this is an actual physical aim to change people's attitudes and behaviors about certain areas. So it's quite a difficult process. So it needs to be, very often they need to be sort of step-by-step processes, because you're doing a behavior change here. So the aim is to get people to take on a healthier lifestyle for different reasons. And the examples, I've actually given some examples here. Smoking cessation programs, something called exercise through prescription, which is when you can now get on the NHS exercise prescribed if someone's in particular need of it, like maybe they're particularly overweight, putting them at risk of heart disease or diabetes. And you can actually give exercise on prescription, which helps them with the sort of financing of going to the gym, and that's that maybe they can't afford to go. So you can get a little help in that respect. The school fruit and vegetable scheme means that the government gives the school some money to add towards their food budget, but the money has to be spent on things like fruit and vegetables. And that's to guarantee that every school where children have their lunches have enough fruit and vegetables to meet the sort of daily requirement, at least. And that extra funding would come from the government. So you can see that that's a sort of very clear behavior change thing. If they give the kids fruit and vegetables at lunchtime, and they get used to it every single day, that they'll be going home sort of expecting fruit and vegetables at home with their parents. That's the idea anyway. And that's about behavior change, because it's making it routine and regular for young kids to have the right sort of balanced food, so they recognize a healthy meal, and the meal doesn't look like McDonald's, you know, in that respect. Now, you would take this approach. This is a way where you believe that the lifestyle change is in the client's best interest. So you're not particularly interested in how they feel about it, almost in a way. You believe it's in their best interest, so you're going to go out of your way to find ways that you can encourage them to do it. Okay, so you're not always taking their views into account. Your aim is to change their views to your views. Okay, and so the activities that you did would be something like that. Or you sort of find different ways that that change is going to work. So I've given you a couple of examples, smoking cessation programs, where we go in to tell people, smoking is bad for you. It's going to make you sick. It's going to make you very ill. We think you should stop. And this is the program that we have. And as I said, very often the programs that you use for behavior change models tend to be step by step. Okay, it's only the fruit and vegetable scheme isn't step by step. They just introduced it all at once because they felt they could with children, that you can get children to do things. If you do it every day, they sort of start doing it. Okay, so those are the examples there. So if your campaign, if you want to do something like a smoking cessation campaign, someone's doing smoking, I think. NIACEC, you're doing smoking, you might choose to take this approach. You might not, it's up to you. But you would probably put a program together. Okay, another approach is known as the client-centered approach. And this is a little bit more like those of us who've done person-centered planning and that. Some of you did that at level 2 and have an idea of it. This is a bit more of a PCP approach, really. It's about working in partnership with clients, and it's about getting them to identify what they want to work on. So it's about, waiting to hear with them, what do you feel that the problem is? And what do you want to change? So it's not me as a professional telling you. It's about you saying they might want to change a lot, they might want to just change a little. So that's really about your relationship with them, and it's about being a facilitator, again, facilitating their decisions and their choices, and you are self-empowering them. And as I said, those of you who were with me on the level 2 before, your person-centered thing, the issues, about bringing people in, about letting them lead their choices, really. So you have to consider them as equal. It's not, whereas some of the others, the health promoter has the power because they have the knowledge and the skill, and often the person sort of else knows nothing. So there's a bit of a powering time. Remember, client-centered approach, person-centered approach, it's an equal discussion, and they are making their choices. And even though you think they're wrong or not going far enough, it's not really up to you. Now, one of the issues about the client-centered approach is it's very hard for you to do this with a group because it is so specific. So what Mrs. Jones on one side wants to change about her eating habits, say, compared to what Mr. Brown over here wants to change about his eating habits, could be very different. She might want to change a lot, huge amount, lose loads of weight, do this. He might just want to tweak some of the things, or eat a slightly balanced meal, a little bit better balance, and just lose a few pounds maybe, or just maintain the weight he's got. So somebody might want to be putting on weight and somebody might want to be losing weight. So it's a very difficult thing to do with a group of people. Client-centered approach is something you can really only do, in a one-to-one basis, because that, that goes with the philosophy, doesn't it, of client-centered care, person-centered care, really. Yeah, you're taking them, you're listening to their individual thoughts and ideas. You could have a very small group, but you couldn't work with a group of sort of like 30 people all at once, because it just wouldn't work. So think about that. If you're doing a client-centered campaign, you might decide that you're just working with one person, or a group of 3 or 4 where they can discuss it, but they can share views. But the fact is that each person's plan will be slightly different. So again, you might think that that's an approach you want to take, but you might be aware that, when you go to your boss at the end of the day, your statistics will be quite low. The work will be quite intensive. So you've got to be fairly practical. However, for this assignment, it's okay to do that if you want to choose to do that, but you do have to talk about, the strengths and weaknesses of the approach. So the marker, knows that you are at least aware of it. And if you chose to take that approach because you think it's a good one, that's fine, as long as you justify it to me. Okay. The societal change approach is not one that you'd be able to really do for this assignment, but I need to tell you about it anyway. And it's about making big changes to the physical, social, and environmental environment to improve the health of people who live in it. This is something that's driven from the government, and health promoters might be out working as part of it, but normally it's part of a very large plan. So it's focusing on changing the environment, really. So it might be about bringing in new hospitals and clinics so people can access health quicker. It might be about bringing in, developing some better housing for the poorer groups of people who maybe live in very bad housing, and that will change people's health environment, but it will also change their lives. It says the focus is not desperately on changing lives, but in fact it is, because lives do change as society changes. So lots of different things really, but not something you could do on your own. Your health promotion role would only be part of a much bigger thing here. It's something that's usually driven by central government and then your local government. Okay. And if they were changing housing to improve housing or improve sanitation, say, as a health promoter, they probably wouldn't bring you into that. So in that sense, the health promotion role is not so strong here. Okay, this is a classic one that a lot of people quite like to use, and that's fine, really. The fear approach. The fear approach has been working quite well for a long time. One of the ones I remember in the 80s when it came out was the AIDS epidemic. The adverts we had for it were absolutely terrifying. The TV adverts, and they certainly worked, had everyone rushing off to get blood tests and things like that. So there are plenty of health promotion campaigns that are designed to elicit fear. Some people don't always think they're that ethical, but it certainly can be effective if the campaign allows for the desired behavior to be reinforced by a reduction of the level of fear. So if you're just left with the fear, that's not really very helpful. But if your campaign says, if you do this, this, and this, you will reduce the chance of, your illness getting worse or you getting this illness. So they will know they've got less. If they do this, they won't be as frightened. Then that's, that works for people. And if you're happy to take that approach and you want to create a campaign like that, that's fine. Can anyone think of an example of a campaign that's probably going on at the moment, well, in most countries of the world that I know of, that's fear related? Any smokers amongst you?
No. I don't know.
No, good for you. Well, if you have a look on someone who does smoke, if you pick up a packet of cigarettes, nowadays it's becoming very hard to even see what packet of cigarettes you have, because they've got so many warnings on them, really horrible, you know, health warning, you will die if you, you know, fear of death. I mean, they don't mess about with them. They're quite extreme, some of them. And some of the, if you're really unfortunate, some of them put photographs of sort of really horrible lungs, you know, when people have died and they've cut them open and that. So, I mean, that is a classic fear approach campaign, you know, there's nothing quite like buying your cigarettes and having a picture of somebody's dead lungs on the front, really. And then on the back, it says, you know, there's a high chance of death if you smoke this. So that is quite a classic one. Now, if one of you wants to create a fear campaign, that's all, yeah, I mean, you know, it can be fun to do, I must admit. You have to think about, you know, how would people behave to that? And what you might have to do is interview a few people and say, if I showed you this, how would you behave, really? You know, would you stop, or would you go, oh, go away, you know, I'm not having any of that? Because yeah, you know, it has worked with smoking. We know that it has worked, hasn't it? But I don't know if it's the fear campaign that's worked, or the fact that they've made smoking very socially unacceptable by not allowing you to smoke in a lot of public places, making it very inconvenient, and that, I don't know. And then, you know, the social sort of push of most people's children hate it if they smoke, so, and all that sort of thing. I'm not sure, but if you wanted to do a fear campaign, as I said, they can be quite good fun to do. I'd be happy for you to do one.
I have a question.
Yes.
Can obesity campaign also be done under fear approach?
Oh yeah. Yeah. I mean, you'd have to be. The difference between smoking and obesity is, you know, smoking is really clear. No one really argues about, you know, damaged lungs and that. And obesity, whatever you put in it, it would have to be truthful. Because if it's not truthful, you've blown the campaign. Yeah. But you could, yeah. I mean, you could have, you know, people sort of keeling over with heart attacks or things like that. I don't know. You know, a really horrible film of someone fat falling over and dying. Yeah, I guess. Yeah. But you just got to make sure it's truthful, I suppose, in that sense. Because the difference is that not with, in the same way as smoking, not everybody dies of smoking, even when they smoke a lot and they're still smoking when they're 90. There are some people, which I don't know why, nobody knows why, it hasn't completely damaged their health and they haven't died. So you have to be fairly honest about it. But the majority of people, it, you know, it would be damaging. And it's the same with obesity. There are people who are overweight who just plod along quite happily, really, and don't have any major health problems. But I mean, you could easily find the statistics, you know, and if you said the majority of people who are overweight are more at risk of health problems, and you could find statistics to back you up. So as long as you have been fairly truthful, yes. The fear approach is quite good for drug abuse as well, and alcohol abuse too. Yeah, as you can imagine, the same sort of thing. Okay. All right then. I will see you all Tuesday. Have a nice weekend. Okay.
Thank you, teacher. Bye-bye.
Okay, bye-bye. Bye all.